Hi, parents. I want to take a minute to talk about seizures. There's really nothing worse as a parent if your kiddo is having a seizure, knowing what to do, knowing how to respond, or knowing the help to get. It's just so hard. We've been blessed and had the opportunity to take care of numerous kiddos really over the past 10 years in our practice of kiddos that have had seizures. And the hardest thing with a seizure diagnosis or trying to get that seizure diagnosis is really knowing what's causing them or where they're coming from. There's so many different kinds, right? There's febrile seizures that are triggered by immune function. There are seizures that are triggered by environmental factors of exposures and things like that to, different weather patterns and different chemicals and all these different things. And then there's ones that are literally misfiring aspects of the brain. And so it really makes it difficult as a parent to know where to turn. The traditional medical approach would say, we're going to go and we're going to test the brain. We're going to do studies that look at an EEG of the brain to see where are the misfiring signals. And oftentimes the answer to that is to go on medication to help lower or dampen those misfiring signals. Now, the sad part is a lot of times those medications don't work all the way. You have to go up in medication, and it really is a struggle for parents. And so when we see them, is oftentimes where that treatment isn't working. And the thing I want to talk about tonight is really going beyond the traditional approaches to it, because if those don't work, a lot of parents just have trouble of knowing where to turn. And I totally, completely understand you because I've had this conversation with so many parents. So I wanted to do this quick video that goes over a couple different slides because there's nothing wrong at all with the way we start looking at seizures from a medical perspective, right? They're looking up here. They're looking in the brain. When we look at the brain and we look at this slide to the left of brain function, most of the time they look for seizures in this upper hemisphere, the cerebral cortex, the frontal lobe, the occipital lobe, the areas that are essentially the outer part of the brain. They can see the signals that are either misfiring or miswiring, and that's often what caused the brain overload, thus the seizure from the input into it. But that's where we really have to look at it differently, is if this area is overwhelmed, where is that coming from in the nervous system? And that's why I wanted to put this picture, because the central nervous system isn't just the brain. It's the brain stem, it's the spinal cord, it's everything that comes from here up and then feeds the brain. So when we look at seizures from a pediatric chiropractic side of it, it's not even looking at it as a seizure. It's looking at it simply as how much feedback is coming from the body and certain areas of that nervous system that communicates down and up that goes to the brain. See, what happens so often with, and I'll say this especially with kiddos, is this upper neck region is so sensitive to neuromuscular tension, to sensory tension, and to all those different, I call them neurological processes of the body, where during the birth process, during development, there's a physical trauma, there's a chemical trauma, there's an emotional trauma, and something up here in this area, really C1 through C5, gets imbalanced, gets tense, gets tight. All that feedback, all that stress is going to feed into the brain. And if that's feeding into the brain and that's extra stress, that can also cause an overwhelm. That's where we've had the opportunity to help so many kids, is when the seizures aren't just coming from up here in the cerebral cortex, when they're coming from the brainstem, when they're coming from that cervical thoracic spine that's feeding up into the brain and overwhelming it. When you take that away, it allows them to really thrive and then put more and more distance in between those seizures. And honestly, a lot of times going seizure free. That's why I have a picture of this little girl on the screen. We have her story of hope in our PX Doc site. I will link that along with an awesome Seizure article for all of you listening. But her story is exactly like I started with. Kiddo who just honestly was parents were trying to figure out, okay, is it immune? Is it febrile? Is it from the environment? When it turns out, and we did our technology and our scans and looked at it, it turns out it wasn't as much upcoming from the cerebral cortex and those misfirings, but it was too much coming from the bottom, from really the cervical spine that was feeding forward. Now, when you look at that, that allows us to then see, okay, what does that do to the brain when we get stress in this? And I wanted to show you this middle picture because when we look at normal synapses, we see connections all over the place. But when we get a stress synapse from tension, from stress, from everything that comes up, the neural connections become fewer. And that's the exact definition of what happens with seizures, right? We get an absolute overwhelm and it causes the brain to really misfire, to slow down, to reset, to have to really almost just stop so that way it has the time to rest, relax, and refuel. And so, not saying that this is a care for every single kiddo with seizures, but if you're struggling where you're having to continue to go up on medications, where you're continuing to get that overwhelm, not just from the seizures, but from behavior, from emotions, from social anxiety, things like that, it might be likely that it's not just coming from the upper levels of the brain. It might be that feedback. And that's why I have this scan here. That scan really shows where the signals get crossed. On this little girl, this is exactly what she had going on. She had tension that was bouncing back and forth. So a lot of energy here is feeding forward into that brain and causing that overwhelm. Now, here's the thing. There's not a lot of research and documentation that goes into seizures outside of medication and really that realm. And that's something we're working hard on. I'm going to attach an article to this that shows a little bit of the science behind what I'm talking about here. But we also know that every single case is different. And that's why we need to do an in-depth consult. We need to use our technology, we call them scans, to really dive in and see where the seizures are coming from. Are they just from up here? Or are they really coming from that lower neurospinal muscular system that's flooding into the brain? Because if that's the case, then we'll probably really be able to help them. So wanted to record this quick video to let you know that there are people there to help. We're here at PwC. There's pediatric chiropractors all around the country that would love to dig into your child's case if you're struggling with any type of seizure, focal, whether it be febrile, whether it be more myoclonic, all of the above. We are here to help. And so we've been through there. We've been through it before as docs, as parents, as really seeing patients struggle, and we want to help you. We know every situation is different. So let us know how we can best help. And we would love to dig in and help your kiddo just to honestly thrive. And because we know how scary and how tired you probably are as a parent when you have to not know why your child is struggling.